In my role as a diabetes educator, I help the patients to assess how well they're doing with their diabetes. I help them to find areas that perhaps are little stumbling blocks, places that are barriers to them achieving their diabetes goals. One of the things that helps a lot and that your healthcare professional, your diabetes educator will need is those numbers. You can't do much without the numbers because that tells you, it tells you everything. Again, how the foods you're eating are affecting you, how the medications are working. Just because you're swallowing the pill every morning doesn't mean it's going to work right. Just because you're taking the shot of insulin that your doctor prescribed doesn't mean it's going to work right. Unfortunately, there's no magic formula, there's no magic number, there's not lab work that I can draw, particularly to tell me where everything works and how it's working best. There is a hemoglobin A1C that gives you the average blood sugar for the last about 90 days. The problem with that is the average. So if you have an average blood sugar of 130, that means your sugars could have been 125 to 135, or they could have been 60 to 200. That still gives you a 130. So you don't want to have those big swings. You don't want your diabetes bouncing around all day long. So that's why it's important to check your sugars frequently as you can, as frequently as you can remember, as frequently as you can afford, and take those numbers with you to see your healthcare provider so that, again, you can assess those numbers to determine if you need to make changes in your diabetes regimen or your treatment regimen. Now, most people do have to change occasionally. Spring and summer, they might have a different, or let's say spring and fall. The weather's nicer, you're outside doing a lot of things, you're working the garden, you might not need as much insulin because you're more active. Summertime, it's too hot. Wintertime, it's too cold. If you tend to be housebound during this winter because it's too cold and you're just sitting and watching TV, you're either going to need to eat less or exercise more, finding something in your house, get yourself an exercise bike or a treadmill, or maybe adjust your medications. But again, these are not static things. They need to be kind of a bit flexible, again, to help you to maintain a normal sugar.